Dr. Shannon M. Clark here. I am a high-risk pregnancy specialist, and I'm going to give you some fast facts about preeclampsia. So please listen up and share. First, preeclampsia majority of the time occurs after 20 weeks of pregnancy. It can happen in anyone. If you have a placenta, you can get preeclampsia. Here are the most common signs and symptoms. Number 1, persistent or severe headache that doesn't go away with Tylenol. Number 2, vision abnormalities. That includes seeing spots, photophobia, which is light sensitivity, blurred vision, or temporary blindness. And that can be in one or both eyes. The blindness can come and go. Then upper abdominal, across the underneath the ribs, upper abdominal, retrosternal, behind the breastbone, or epigastric pain, which is kind of up above where your stomach would be. Any pain anywhere around here that's new onset could be preeclampsia. Altered mental status, confusion or agitation. New onset dyspnea, that means getting short of breath when you're walking or walking up steps. Now, majority of pregnant individuals have dyspnea just because they're pregnant, but if it's something that is more drastic for you and more notable, then you need to be seen. And then orthopnea, that means when you lay flat, you can't get a good breath, and you might need to prop yourself up in order to get a good breath. And then swelling of the hands, lower legs, feet, and the face. If you're noticing that your hands and your feet and your lower legs are starting to swell, ask your partner, does my face, or somebody who lives with you, does my face look more swollen? Because most of the time, the patient doesn't recognize any facial swelling because they're looking at that face every day. It's usually a partner or a family member who recognizes the facial swelling. If you have any of those signs and symptoms, you should be evaluated. So know where you're supposed to go if you are having any issues in your pregnancy. Are you supposed to go to labor and delivery? Are you supposed to go to the ER? It depends on where you plan on delivering. So ask your ObGyn, at what point, if I'm having an issue, do I go to labor and delivery? At what point do I go to the ER? Every hospital system should have criteria for both. If you're having any of those signs and symptoms and you go to be evaluated and your blood pressure is greater than 140 over 90, or especially greater than 160 over 110, you need to be admitted and observed at the very, very least. Labs need to be drawn. Preeclampsia needs to be ruled out. The treat 'em and street 'em old adage does not apply here. If you go to labor and delivery or the ER and they have to give you something to treat your blood pressure, they should not be sending you home. You need to be admitted and observed at the very least. If someone tries to treat you for your blood pressure with something IV or oral and then tells you to follow up with your ObGyn, that ain't it. Preeclampsia can occur in anyone after 20 weeks of pregnancy and even in the postpartum period, so it must be taken seriously. It is one of the leading causes of maternal morbidity and mortality in this country. And if you feel that any provider is not taking you seriously, ask for a patient advocate.